Hello and a very good morning to you. You're watching News 9 Digital. I'm Pratibha. Today we're going to talk about the need to talk about mental health in the country. Now more than ever, the number of suicides have risen in Japan in August due to more women and school-age children taking their own lives. This is quite worrying, and this could be offering a glimpse into the consequences of the mental health strain due to COVID-19 around the world. Now, these numbers could be an indication of what may be going on around the world as countries are grappling with the mass unemployment as well as social isolation that's impacting certain groups of people more than the rest. And now, of course, Japan is the country where they keep a track of such numbers of the number of suicides that are being reported. It could be an indication of what the situation is like across the globe as well. In fact, we've often spoken about the other impacts that coronavirus can have on the mental health of people. A US study that has been released in May also predicted as many as 75,000 additional people could die in the next decade from deaths of despair as a result of coronavirus crisis, and that's in the United States alone. It could be much more in other countries, and especially in Asia, the toll could be compounded by greater stigma around mental health issues as compared to what it's like in the Western society. So there's a lot to talk about. The more we talk about it, the more we would know about the situation, which is extremely important to know as well. To discuss more on this, a psychologist joins me live. Dr. Sridhar joins me. Many thanks for joining us. Doctor, this is quite worrying. The numbers that we're seeing from Japan could be an indication of what the situation is like across the world. And India, we've already seen the unemployment that has been caused. So, the economic impact of it on one hand, there's a lot more to worry about because in India, a lot more people also struggle to cope with mental health issues. They also, because of the stigma attached, perhaps people even refuse to speak about it. Is that a big problem that you've seen in the country?
Yeah, it is. It is a gigantic problem. The statistics elsewhere in developed countries, which are quite authentic, is an indication that stress levels, especially at the mental health issues, they're definitely going to cause a lot of life losses. So it's a very serious issue. Looking at people, committing suicide or getting into distress, wherein there is no medical facility or no mental health facility, will definitely impact on human resources development in a country, especially like India. So it's a very big issue we need to focus on, at least now.
Absolutely. And, now even as the country is also debating the death of an actor, that as we have seen as well, because of that as well, it seems like the stigma over mental health only seems to be increasing. It's not decreasing. And that could be very detrimental as well, because now is the time we should be much more aware. And in case of coronavirus, it's not just the economic impact, isn't it, Doctor? Because we're also talking about a social impact that it has had. We don't go out as often. We don't interact with other people as often. So is that also having an effect on people?
Certainly, yes. See, the method of social interaction, that is being regulated, controlled in a way which is more harmful to individuals, especially people in a certain age range, where the activity will always give them a lot of confidence to look at the future. Now, unfortunately, such an interaction is being restricted for whatever reason, and the method of restriction itself is causing a great distress on individuals' coping pattern. In the sense, in a small, even in a big place where you are not supposed to interact with people for medical reasons, or even when you are interacting, you are all the time conscious about it, or all the time need to be careful, which will once again increase the level of stress because there is no spontaneity. So the entire human enterprise of interaction or social interaction is being regulated by certainly a pandemic like this. But then we should have devised, or at least we should devise a technique of helping individuals not to get into the stress mode.
Okay. Also, Doctor, during the pandemic, is there any particular group that's getting more affected than the others? Women perhaps, or a particular age group that's getting more affected because of the pandemic and, the effects of it?
Every group, I can say that in every age range except the infants probably, even there the feeding mothers or the mothers seem to be, nursing mothers seem to be in some kind of a distress relating to feeding habits or the method of life and social adjustment or even, goal setting mechanism. So it's affecting everybody. It's generally, it is such a thing that it's affecting everyone. That's what I can say.
Okay, so doctor, your a word of advice for people who might be any kind of stress or might be feeling uncomfortable with it, especially with the fact that this uncertainty is going to continue and we don't know yet when the situation will come back to normalcy. So for anyone who might require any kind of help, what is the advice that you'd give them?
Now, what I feel is this is kind of a very big social issue. So we need to have social groups like, professional groups, for example, in the IT industry, people or school teachers or the school children. They need to develop their own kind of a self-help group because they know their problems and they know what exactly need. Because the goal is already set in these cases. For example, a student is social interaction plus education plus knowledge acquiring. So if they have a group like that where they can come in and support or look into the problem with less of analysis, probably this could help. That means the self-help group need at community level. That is what I think is one of the best methods of reducing the pressure on individuals, because your friends who have a problem. I mean, instead of going to a specialist, probably this could be one of the best methods of regulating it.
All right. Dr. Sridhar, many thanks for joining us live with your expertise on the subject. So there are two issues. On one hand, not enough help being available for people who might require it. And on the other hand, the stigma as well that is around mental health. That's quite a worry, because of which many people also worry about speaking up even if they are under stress. So if you are feeling any kind of stress, then do speak and reach out to somebody who is trustworthy. Talk to them. There are several helpline numbers as well that are available. Or if you have seen anyone else who is stressed or you think that might need any help, do talk to them. Sometimes just lending a very patient ear also helps extremely, and if not, then they can also seek professional help to ensure that they battle any kind of illness that they might be facing. Of course, for many people, the pandemic has affected all of us in several ways, but for some people, it might be affecting much more and they might not be in a condition to battle it, which is why it's important that we ensure that we're reaching out to anybody who needs our help. Thank you so much for watching this video. Please let me know in the comment section as well what you think of it. I look forward to that. Thank you for watching.